Okay, doctor, let's evaluate your letter. This is fine. Dear Dr. Umar, it's better to write, if you have to write the name of the doctor, then just write this one, Dear Dr. Umar. Mrs. Samani, Zai, date of birth, this, okay, this is fine. I'm writing to refer a 40-year-old married woman with 4 children, 3 girls, for the purpose of breast surgery. I mean, you don't need to tell how old she is, whether she is married, does that make any sense to anyone? If you're writing in the purpose, it's completely irrelevant and wrong. For this purpose, for the purpose of, I'm writing to refer okay, Mrs. Khazai, for the purpose of breast surgery, to treat breast carcinoma. See, I do not like this purpose at all. I'm writing to refer, and if it is surgeon and there is a cancer involved, so you can even write this into the urgent as well. But if you want to write it in a simple referral, that's okay, but you have to write in a different way. I'm writing to refer Mrs. Khazai, who has been diagnosed with breast cancer. Okay, your further assessment and management, including breast surgery, would be highly appreciated. Okay, that's the way you have to write it down, not the way you have written. And don't write 40-year-old whether she is married. I mean, if she's not married, can unmarried people cannot have cancer? They can have cancer, right? You don't need to tell the children of 4 children at 3 years old, 7 years old. I mean, this is completely silly thing to write over there in the purpose. Initially, she presented to me, write the name, Mrs. Khazai, okay, presented to me on this date, complaining of left breast mass, which was not painful and no nipple discharge. Which was not painful and there was no nipple discharge. Okay, and no nipple discharge was here. Okay, that's okay. On examination, mass was 22 centimeter in size with wet ill-defined margins. In addition to axillary lymph nodes were palpable. Therefore, mammogram or ultrasound tests were ordered. She has she was. You're writing everything in the past and against suddenly you have written in a present. So she had, I told you in the lecture as well, she had a significant past medical history of, this is a history. Breast lean and has also breast carcinoma which undergone. This is a history, so write it in a history paragraph. There is no need to write this information in a paragraph of a visit. See, you have to use common sense as well, where you are telling that it is a past medical history and you are writing inside the paragraph. That's completely silly. Okay, again, Mrs. Khazai had anxious and felt worrisome about the test results as 10 mg referon was commenced. The test results, see, please first of all improve your writing. That's the main thing. Okay, if you write this way, I don't want improved writing. At least make some clear words. This is the cutting. You are not writing a letter to someone who is younger brother or younger sister of yours or mine. Okay, we have to be professional. If you're writing a letter, write it in a proper way. It should be aesthetically pleasing, it should be ethically good looking. Okay, this is not a way to write it down. And then please do not see, what is this, what sort of word is this? I can't see it. Okay, then what's that? Are you really writing a letter? Okay, and you have to pass your OET this way? Then I'm sorry, things will not be very well. Okay, please do make, when you're writing a letter, even if you're sending to me, this is a practice. If your practice is wrong, your outcome will be wrong. So please make sure that you write properly. With don't write things in a hurry. You have 45 minutes, which is more than enough to write a letter. I can write 2 letters for you in 45 minutes. Okay, so please do not do this sort of behavior, please. Now what's this is with, this is an, this is not a good way to write it down. Multiple nodules in the axilla region, moreover biopsy was recommended and was advised. See, this is bad to discuss. What is this? Various treatment option. Variable treatment option. Okay, today biopsy result has confirmed breast carcinoma. She needs an, what is this? If I can't read it, they can't read it. Okay, then there is going to be a problem. Please note, I won't give you passing mark. I will just give you 290, and I'm giving 290 in a very lenient way. Okay, please don't do that. Write proper letter, doctor. Do not make these sort of things. And I can assure you that if you keep on making and things and writing this way, you might have been passed this previously, but this time I doubt, honestly.